This is Boomer Life on CL 650.
You know what, Dwayne? I was thinking we should have had Jackson Browne, Doctor My Eyes. You know that song? We'll do that next time. Always try to get some good songs for the intro of the show. We are talking about pain and managing pain and things that you can have access to that will alleviate and maybe even regenerate your body. Integrative Naturopathic Medical Center is at Broadway in Granville. Which building are you in there? There's the...
well, we're actually at Birch.
You're at Birch, okay.
Yeah, so it's really 2 blocks east of Granville.
Okay, yeah, because I know there's the big Chapters bookstore on the corner, so you're east of that.
Yeah, we're 2 blocks east.
Okay. Now, we have Dr. Hal Brown here. We're talking about the kind of injections you can have for regenerative therapy. So the name sounds like you're regenerating your body, and can you rebuild something that you've lost, generally, when you're talking about pain and joints and things like that?
You can grow back new tissue. This
Yep.
is what the research demonstrates on animal studies that where they've done the injections, and they've demonstrated that what happens is that new ligaments, new tendons grow back on the matrix of the old.
Mm-hmm.
So you end up with thicker, shorter, stronger, and more flexible tissue than what you had there before.
Which sounds like it's new and young.
That's
versus,
exactly what it is.
Yeah.
Yes, exactly. You have a second lease on your joints.
So what happens with age? We talked about it earlier. When you were young, you would fall down and you would hurt yourself, and you were sore for a couple of days, and then you're back out with your friends running around when you were a kid. So what happens? You have the inflammation, and then you have the soldiers all come in, and the blood cells all get around there, but you have that growth part of it that isn't as effective as when you were younger. What happens with age, redoing joints and things?
Well, there's a few things that happen. One is, the old problems from our weekend warrior days. Your body tends to compensate and adapt to injuries. So, for example, if you've twisted your ankle and you want to keep running, then you'll start running and you'll kind of put a little more weight on one leg than the other.
Mm-hmm.
Then that will cause a bit of a strain in one of your pelvic bones, perhaps. And then your back may twist a little bit to adapt to that. So we call that adaptation or compensation. So when we're younger, we can adapt and compensate, and we can transfer the load all over the place, and we can manage this quite well. Then what happens is, as we age, this compensation system tends to start to break down. And that's when people start coming in, and they used to run marathons, and now they can barely walk around the block.
So what you're saying is the part of the body that has been compensating for the underlying problem kind of gives up and says, I can't do this any longer.
That's right.
Yeah.
That's right. And then we start fixing that, and then something else happens.
Yeah.
Another older problem shows up.
Sure. So so the regenerative process can be accomplished even with people who are getting older. We were talking about when you're younger, you compensate. So you're saying you can regrow parts of the body back that we had lost or had been irritated or damaged.
Oh yeah, I have patients in their late 80s and 90s. I just had a run in the last couple of weeks. I think I had four gentlemen, late 80s, early 90s, coming in for treatments, been responding terrifically.
Really?
Yeah.
And so what can you work on that can be regenerated? What things can be done and what can't be done?
Well, if you've got for example, a common injury in the knee is tearing of the anterior cruciate ligament.
Mm-hmm.
If the anterior cruciate is torn, but they're still connected, that can regenerate. If it's torn in 2 pieces, can't do anything but surgery for that.
Right.
Or leave it, one or the other.
And what about joint pain? And you have the between, say, your knee bones, you have the lubrication there that wears down over time, and then some people get bone on bone, and that's really uncomfortable.
Yes.
So with joints degenerating over time, can you do something for that?
You're talking about osteoarthritis,
yeah.
Degenerative joint disease,
mm-hmm.
right? That's when that's part of aging. It's also accelerated by injury and damage, for sure. But even as we age, all our joints get the spaces get smaller. That's why we shrink, get shorter as we age. I used to be an inch taller.
I said my grandparents were so
Yeah.
little.
Yeah, so so as the joints shrink, the ligaments actually don't shrink. They're still the same length. So the joints are now more unstable, and that creates more degenerative change. So once things get to a certain point of degeneration, like once it's bone on bone, probably there isn't much you can do for it. But if the cartilage is thinning out and those joints are arthritic, then we may have to think about something a little bit more aggressive than just prolotherapy. Then we start looking at something like platelet poor plasma, or PRP. I think a lot of people have heard about that now. When we were talking about the inflammatory cascade and the remodeling and the healing from that process, I mentioned that when the blood comes in, it brings in platelets which have growth factors on it. Growth factors are the key to the regeneration. So now what we can do is we can draw out your blood. We can spin it and do all kinds of fancy things to it. We can concentrate your platelets 6, 8, 10 times what they would be in normal blood. Then we can take that concentrated platelets solution and inject that inside the joint. Now you're actually getting growth factors directly, let's say in a knee for example, directly inside that knee joint. So that articular cartilage inside the knee is getting the benefit of healing elements in the blood in an area the blood doesn't usually go into.
And how do you sorry, not how do you keep it there? Does it move through the body? So for you're injecting it in one specific area, does it stay there or does it move through the body?
Well, if you put it inside a joint,
Yeah.
that joint is contained by the joint capsule.
Okay.
So the platelets go all through the joint and they adhere to the inside of the joint capsule, to the cruciate ligaments in the middle, to the articular cartilage.
So
and remember, platelets are sticky.
Okay.
So they stick. They don't travel too far.
Okay.
If you put them into a ligament, they pretty well stay where you put them.
That's good to know. I
Which
didn't
is
know
why
that.
you want to put them in the right place.
Yeah, yeah. Oh, well, it's just like saying, like trying to put chlorine in one end of the pool and keep it there. It's going to dissipate. So you're saying that you can target those areas and it will stay.
That's right.
Okay. So what else can this PRP do? Can you give me some other examples?
Well, everything I said about prolotherapy, PRP will do much better. It's going to cause, it's going to have a much greater regenerative effect. So we can put it into ligaments, put it into shoulders, into necks, into backs, ankles, any place where there's been torn ligaments, torn tendons, degenerative joints.
Is this a combination? I'm sort of seeing a picture where you have an injection, you're putting the sugar solution in, and then you're putting maybe ozone in, and then maybe the PRP. Is it a 1, 2, 3? Can you do all three at once? Is it staggered over time? How do you come up with that?
It's a continuum of therapy. I mean, we're always trying to figure out, well, what's the cause of the problem? If we decide the problem is coming from a damaged ligament or tendon tissue, then we're going to want to do some kind of regenerative injection therapy. Okay? Usually, if it's a simple problem, I'll suggest we start with prolotherapy, mostly because it's less expensive.
Mm-hmm.
And most of the time, that does the job. If we see it works, but it doesn't work fast enough or well enough, then we can start to think about using platelets, because platelets are going to be much more effective. You're going to have much more regenerative effect with less treatments. So people that come from out of town, long way for treatments, usually they'll get PRP only because it's just much more practical. If you're going to travel a long way to get the treatment, you might as well get much more of a treatment each time.
Right. Now, we talked a little bit about nerve damage and issues. Can this be used for that as well?
No.
No?
Pretty well, I think of PRP pretty much for degenerative joints and damaged ligaments, tendons.
Okay, so in our final few minutes we have you on the show, what would you say to somebody that's been suffering, maybe they have arthritis or they've had long-term pain and they sort of feel like I've tried everything or they just don't know where to turn? What do you say to them? What message would you give them now in our last couple of minutes?
Well, I would say, don't give up. Okay, most problems have a cause. And you really need to make the effort to get the treatment that you need. I think, most people are going to start with simple treatments, like stop doing the activity that hurts. Take a rest. A lot of the time that's good enough. You have a back and neck pain, go see your chiropractor, get adjustments. A lot of the time that solves the problem. See your physiotherapist. Get the exercise that you need. There's lots of physio treatments that a lot of problems are simple, and they can are not simple, but they can be treated, you know, without really big complicated processes. Acupuncture, you know, just general health. All of these things are critical. So I would say if you've done all those things and your problem is still not resolved, then that would be the time you would want to think about the heavy guns.
Yeah.
Okay, like you said earlier, nobody wants needles.
No.
Nobody comes because I like needles. No. If you do, I'll send you away. No, you're coming because you really have. You've been to the chiropractor. You've been to the physio.
You do what I say. I just want it to go away, right?
I want it to go away, but I've tried everything.
Yeah.
I have, but you have to make sure you have tried everything else.
Haven't you? Yes. I'm
Yes.
glad that you're here. Have you gone to? No. Well, let's start at one and build up from there.
That's right. Yeah.
Well, it's been very interesting. I've learned a lot. Dr. Hal Brown has been our guest from the Integrative Naturopathic Medical Center in Vancouver, near Broadway and Granville, the pain specialists, and it's been a very interesting conversation. Thanks for being on the show.
Thanks so much, Zach. It's been a pleasure.
All right, we're wrapping up this edition of Boomer Life on CL 650. I'm Zach Spencer. I'll speak to you next time.